Thanks so much, Sheriff, for being with us today. We appreciate it. All right, let's jump right in. So my first question for you is, in 1969, Governor Reagan signed the Lanterman Act, creating a cradle-to-grave entitlement for people with developmental and intellectual disabilities, now serving roughly 500,000 Californians at a cost of about $20 billion a year. There's no equivalent entitlement for people with severe mental illness. Do you believe California should create such an entitlement for serious mental illness? And if so, what specific revenue or budget trade-offs would you use to pay for it?
Yeah, we absolutely do. And we are never going to end the homeless situation that we see on our streets if we don't start calling it what it is and addressing it for what it is. It is a drug and alcohol-induced psychosis comboed with a mental health issue that could be made exacerbated by drug and alcohol use. And we absolutely have to get to the realization and the admission that when you are voluntarily asking for someone suffering from a mental health crisis, if they would like to go into a treatment center, you are never going to get them to agree. We absolutely must get to a point that if we're going to be compassionate for the fight that they are in, and if we are going to actually want to help them, we are going to have to force them into treatment so we can get them stabilized, get them back to where they were before they succumbed to the deep parts of this mental addiction or mental health issues that they have, and we can get them back to where they're productive and back to the families and the homes that they once had.
Mm-hmm. And just to follow up on that, you mentioned the driving factor being a drug and alcohol-induced psychosis as a driving factor of homelessness. A recent study from the UCSF Benioff Homelessness and Housing Initiative found that only about a third of homeless Californians that they surveyed were regularly using drugs, and only about 12% experienced hallucinations. What do you make of that? What about the rest of homeless Californians who, do not have those problems?
Okay. We need to start being real and start being honest. If you're not going to ask the experts who are dealing with this, what we have and what we see on the streets, if you're not going to ask us what these people are suffering for and whether or not they're under the influence of drugs, then we are never going to solve this. When you ask an academia to go out and ask someone if they're under the influence of drugs and they tell them no, so they walk away, that's why we're in this position. That is an absolute travesty that we're going toward academia doing research with no expertise in really determining this, and then that drives the solution. You want to wonder why we make homeless worse every single year, despite the billions and billions and billions of dollars that we're wasting, is because we're not being honest with the issue. It is more like 95% of the people that we see on the street are suffering from drug and alcohol addiction, which contributes to a mental health condition. It's drug and alcohol-induced psychosis. This is an absolute fact, and until we start addressing it for such, we are never, ever, ever going to get through this.
And that 95%, what does that come from? What data does that come from? Is that just anecdotal experience in your department, or?
It is law enforcement as a whole. We meet sheriffs in this state. There are 58 counties. It's absolutely bizarre to me that we're having this conversation, because academia and government wants to just keep the problems going so they can act like they're doing something. And do you know who they never ask? Law enforcement. Do you know who is never at the table? Law enforcement. And we are the ones that deal with this on a daily basis. There are 58 sheriffs in this state who meet every 2 months and discuss the issues that we are experiencing all across the state. We all know the exact same thing. Our deputies, our firemen are the first responders to every single one of these calls for service and every single one of these people that we deal with on the streets. It is extremely rare that we find a person truly just a victim of homelessness that truly is looking for help. And when we find them, we jump for joy, because now we can finally input them into the system where there are tons of resources for those people. The ones who are suffering from drug and alcohol abuse, there is absolutely nothing for us to do for them. They don't want the help. It has to be voluntary. And those are the ones that we're seeing on an absolute daily basis. There's no sense in you and I arguing with it. Academia and politicians have created this to cycle money into a homeless industrial complex. And until we are going to be honest about what it is, we will never, ever, ever fix it.
Well, let's talk about the people who are suffering from severe mental illness. So for the next question, the current governor has invested over $16 billion towards behavioral health transformation. What is one major structural outcome that you believe must be in place at the end of your first term for those investments to be considered a success? And how would you measure progress toward that outcome?
Well, progress is actually going to be progress. I am so sick and tired of him just saying, look how much money I've dumped into absolutely nothing and I have no success for anything. Homeless is getting worse every single year. And then we have politicians that come out and we have groups and we have academia that go out and say, oh, look, we have 2% less. Well, that equates to about 4 people. So the percentages mean absolutely nothing. The entire state of California knows that homelessness is getting worse. We know that mental illness is getting worse. And the government just says, look at all the money that we're putting toward it. And it does absolutely nothing. When are we actually going to start directing the money to the people where it actually matters? The people that need it are getting absolutely nothing. The nonprofits and the NGOs get all the money. The government agencies, they employ a whole bunch of people to do absolutely nothing, and nothing is working because none of the money goes to the people that matter. If we don't start actually being compassionate human beings and caring about the people to get them healthy, to make them healthy, nothing is ever going to change. Just keep voting the same way. We'll keep wasting all of our money, stealing all of our taxpayer money. We can increase more taxes so we can say we're giving more people more money to it, and we will still suffer from the same issues over and over and over. We are going to have to get to a point where we all agree that we have to force the treatment of mental health treatment onto individuals, whether they want it or not. We have to make sure that they're healthy, that they're stabilized, back to the families that they have, the homes that they had, and we have to put these into the treatment centers. It's not about NGOs and nonprofits. That's all going away. No NGO and no nonprofit is going to get money with me as the governor. There will be some that come and say, look at what you're doing to us. These people are going to be put back on the street. We'll take a good look at it. And if it's true, we will give them their money back. But there's going to be thousands and thousands of NGOs and nonprofits that say absolutely nothing, because those are the ones that are stealing our money because they aren't helping anyone. And that's what has to be fixed. The waste, fraud, and the abuse of government saying, let's just throw more money at it, has to absolutely stop. I actually care about other people, and we are going to make sure that California government actually cares about the people suffering from the situations that they find themselves in.
Mhm. Let's delve a little bit more into what your homelessness policy would be as governor. I know, it sounds like you don't put much stock in some of the statistics that are coming out. And though California does still have the largest homeless population, the latest data does show that last year saw a 9% drop in unsheltered homelessness, breaking a 15-year trend of growth.
Do you know what a scam that is? That is an absolute scam. So they were sheltered before, but it was called a tent. So because they put them in something with a hard roof, they call it unsheltered. We have been abused by words, that words in a psychological warfare type of an attitude where words are used against us, and then we use that for better statistics. Unhoused homeless means absolutely nothing compared to sheltered homeless. They're the same homeless, they're the same drug addicted, the same mental illness. Let's stop with this. If you can honestly tell me that you can walk outside and think that homeless is getting better, I want you to tell me where you live so I can move there, because no one in this state believes that homeless is getting better. It is worse every place across the state. We need to stop this.
So what would you do? It sounds like, it sounds like you're talking about the tiny homes. You don't see tiny homes as a solution, and you
I am going
mentioned you
to,
wouldn't give any money
it's
to
not
the
the solution.
nonprofits or the
It's not the,
NGOs.
it's not
So
the
who would get
solution.
money and
It's
for
not the
what?
solution. I've said it. Let me be very, very specific, because I said it already. This is not about homes. Stop calling it homes. Homeless was used because psychologically we feel sorry for somebody that doesn't have a home and we believe they're forced to live on the street. That is absolutely false. This is not about homes. Stop calling it homeless. It is drug and alcohol abuse, drug and alcohol addiction, mental illness, a combination of both, and psychosis. And we have to start addressing it for what it is. Every single bit of money that is going to the homeless industrial complex of NGOs and nonprofits is going to stop. A small portion of that money will go to in-home care for drug and alcohol abuse, mental health care, and here's the biggie, the combination of both. Did you know that before California made drugs legal in 2014 that caused the spike in the homeless and the mental health issues that we have? Did you know that they passed another law that made it illegal to treat mental health and drug addiction at the same time? This is government created. It is government imposed, and law enforcement has been saying this for 14 years, and no one listens because they wanted this to happen. This is about cycling taxpayer money into a homeless industrial complex, and these people living and dying on the street are pawns in this little scheme to launder our tax money, to make people rich, and then foster some of that money back into the election cycles to keep these people in office. Californians are absolutely sick of this. We're actually sick of reporters. We're sick of liberal reporters that just keep sob storying us with absolute fake statistics and lies. We're so over this. We are absolutely over it. That's why I'm leading in the polls. That's why people are sick of politicians, because we're sick of being lied to. We actually want people to care. We want leadership in this state, and we want someone to actually make a difference. And the career politicians that lie to us every 2 years and every 4 years, we're over them. The homeless industrial complex can be ended within 2 years max if we actually cared about them. All you have to do is go to Los Angeles and see that not only the state money that's being dumped into them, but the $2 billion per year that's being dumped into Skid Row is only meant to keep those people there, victimized by their drug and alcohol addiction. We give them money, we give them drugs, we take away the crimes. This has to end. We can enforce laws. We can keep them in jail. It has to go back to the consequence for crime. AB 109 has to be absolutely repealed. State prison inmates have to go back to state prison. Then our county jails can actually house people for misdemeanors and low-level felonies, which they can't do now. So these people who are stealing from us, the people who are using drugs, the people who are selling drugs, all of them can be put into jail. And then, like before Prop 47, before 2014, we could tell them, you're either going to go to rehab or you're going to go to jail and prison. You pick. They always picked rehab. That's what we want. We don't want them in jail. We don't want them in prison. Take the rehab, take the live-in rehab, and we can get you sober. We can get you clean. We can address your mental health issues, and we can get you back to the families that you all once had, and everything was fine. 2014, Prop 47 changed everything for the negative, and we all know it. We have to stop acting like it didn't happen. Prop 36 would have solved a lot of our problems because we would have been able to force these people the same way, go to jail or prison or into rehab. But our current government, Democrats, and our current Democrat governor will not implement or fund the resources to make Prop 36 work. Why? Because they know it's going to work. And then the entire state of California is going to know that their policy for the last 12 years has been a dismal failure. It's a social experiment that has failed. They've doubled down, tripled down, quadrupled down. Democrats in our state legislature, not Democrats in California, Democrats in our state legislature and our Democrat governor couldn't care less about anyone in California, particularly the people who are living and dying on our streets, and it has to stop.
Well, since you mentioned Prop 36, I know it hasn't been that long since it's been implemented, but
It's been over a year.
The early reports so far, so it's been over a year, but the early reports so far are showing a lot of the people who are arrested under Prop 36 for these drug felonies are not choosing treatment. And even those who are choosing treatment, only a very small handful have graduated. Do you think that's just a funding problem?
It's both. It's absolutely a twist of fact. We have absolute horrific political activist judges who are refusing to sentence under the 36 guidelines. So they go back to Prop 47 guidelines because they don't agree. They don't care what the voters in California want. They don't care about our Constitution. They don't care about any of that. They care about their political agenda, and that is it. It is an ideological agenda, social experiment that has radically failed in California, and we're over it. We're tired of it. We want the radical judges gone. We want got the funding so we can help these people. They are not going to willingly get themselves help, especially with mental health issues. We have to be able to force them. You still haven't changed the Prop 57. You still haven't changed the AB 109. So when you put these people in county jail, I can't keep them for these low crimes because I'm housing state prison inmates. The system has been set up for failure it's not by dumb people. They did it on purpose. And we're suffering the consequences. And until you put somebody in place that's actually going to right all of these wrongs and inform Californians of the truth instead of the garbage statistics, the garbage things that they think we want to hear, nothing is going to get better. It's gotten worse every single year. And as long as we keep voting the same way, it's going to get worse next year too.
Let's go back to your homelessness policy briefly.
God.
Speaking of funding, I know you mentioned diverting a lot of funding away from nonprofits and NGOs. What about cities and counties? What would you do with the homeless housing assistance and prevention or HAP funds? Would you keep that going?
Yeah, I don't think you're listening. I really don't think you're listening. Stop calling it homeless. I watch what they do in my county. This is not about homes. Stop calling it homes.
I mean, that's the name of the government funding source. So I'm just asking you about this specific program that is called
It's for homeless. Why do they call it that? It's to psychologically affect you so you feel sorry for people and you don't care where all this money's going. And then when I stop it, you're going to get all emotionally affected and triggered because I'm stopping the money for people with homes.
So
and
you
the
would stop
reality
HAP
is,
funding.
The reality is it has nothing to do with homes. We have to get over this. Get over the home part. They need treatment. They need in-home treatment care at drug and alcohol facilities and mental health facilities. And unless you're going to just listen and agree that that's going to happen, in 4 more years, you can be talking to the next governor about the same thing and wonder why we still have homeless on the street.
So you would stop HAP funding?
I'm stopping every bit of funding that has been wasted for the last 20 years on this thing you keep calling homeless, because that's not what it is.
Okay, and it sounds like you would really be pushing for involuntary care. So let's get into a few more details about how exactly you would do that. How would you change the current standards that now require someone to be gravely disabled or a danger to themselves or others to be committed into involuntary care? How would you change that framework?
The law for mental health into involuntary care is going to have to be changed. And this is how it's going to work. I don't know where you live. I don't know who the people you talk and this confirmation bias that you might be in, but the rest of Californians are absolutely sick of this. We are absolutely sick of what we see on the streets. We're absolutely sick of being confronted by mentally deranged, drug-induced psychotic people when we go to the grocery store or the gas station or even a business to try and eat or going to buy clothes. We're absolutely sick of it. And we want someone who's actually going to make it better.
What do you think about Care Court? Would you keep that program? Would you change it?
Care Court was a way for Newsom to say that he was doing something, and it doesn't work. We are going to absolutely remove Prop 47. And here's what's going to happen. When I tell people, the entire state, every week on the steps of the Capitol, when I tell people who are the lawmakers there that are not working to make California better, then when they come up for election again in 2 years, none of them are going to get elected. Absolutely none of them. The only thing that those people in Sacramento fear are an informed voter, because all of us believe that they're there doing the right thing, and none of them are. So when the public is informed that they're not doing the right thing, that they're doing nothing to fix our homeless issue, doing nothing to get people mental health care, then they're not going to get voted in again. So my worst case scenario as your governor is I'll have 2 years of fighting with them trying to do the right thing. Then they're never going to get elected again. And people that actually care about Californians will, and then we'll be able to save our state.
And let's talk more about structural barriers to getting people the mental health care help that you're talking about. The Medi-Cal system is a key safety net for people who are poor and at risk of homelessness. Right now, Medi-Cal patients often get primary care in one place, mental health care in another, and substance use treatment in a third. With county carve-outs creating constant handoffs and gaps. What specific structural reforms will you commit to in your first term to end or significantly shrink this fragmentation? And who should ultimately be held accountable for a person's care across these systems?
So every single bit of that is going to be changed because you said exactly what I told you was broken. The state government set this up for failure to create this homeless industrial complex so they could get elected every single year. We already know this is happening. We already know that the billions of dollars wasted on homeless, a portion of that is going back into these election coffers to keep them getting elected. Why are you not talking about that? Why aren't we doing interviews about that? Why is DOJ not arresting the people taking that money? Because they're getting that money too. This is nuts that we're even having this conversation because it is so common sense. The doctors know it, the social workers know it, but the system has been set up to keep the money flowing, to just keep people in government employed or nonprofits with their funding. And the people who are actually needing the treatment get absolutely nothing. The entire system was set up by California lawmakers, California regulatory boards and commissions, and it was set up for failure, and we have to demolish it and rebuild it, actually caring about the people that need help. We have to get to a point where the legislature passes a law that we can actually force people into mental health treatment, whether they want it or not. Because if you ask someone if they want help who's suffering from a crisis, mental health crisis, their answer is going to be no. They don't think anything's wrong. They think you're the one that needs the help. They think they're okay. They're never going to say yes. We have to force them in to get them treatment, to get them stabilized, to get them to where they can make rational decisions, to accept their own care and move on.
Well, I think that's all we have time for. Thanks so much for joining us. We appreciate
Yeah,
your time.
of course. Thank you.